Our opening music selections from Los Voices de Latinoamérica, Cesaria Evora, and Orchestra Baobab. Today's panelists are global leaders in CRVS who have a combined 50 years of experience as advisors and statisticians working with the UN Economic and Social Commission for Asia and the Pacific, the United Nations Population Fund, Open Data Watch, and Vital Strategies. While Data for Health focuses on collecting and utilizing CRVS data to improve countries' public health, we would be remiss in light of current events to omit mention of the humanitarian impact of incomplete and inaccurate vital statistic data on women and girls. To excerpt from Dean Ellen McKenzie's note to the Bloomberg School of Public Health community earlier this week, the Bloomberg School stands in solidarity with the people of Ukraine as the situation is evolving into a full-scale humanitarian crisis. Top of mind for us is the threat to vital public health services, end quote. This threat in the region includes civil registries and vital statistics. Children have been refused entry into neighboring countries because of incomplete or missing birth records. Women who died in childbirth while trying to escape Ukraine have not had their causes of death recorded accurately. The speakers on our panel today have been working on population estimates for Ukraine based on existing CRVS data to support the UN humanitarian response. Again, I quote Dean McKenzie, "Even as Ukraine is on our minds, we must also remember the humanitarian and public health emergencies that affect refugees from Yemen, Afghanistan, Ethiopia, and Syria," end quote. These ongoing crises have the longest lasting and most adverse public health effects on those who are most vulnerable, including women and girls and people who are non-binary. Our work on inclusiveness for birth and death records is more critical now than perhaps ever before to improve the public health of people globally in humanitarian crisis. Now I'd like to introduce our moderator for this session, Tawheeda Wahabzada, a data and policy specialist at Open Data Watch, who has both deep professional and lived experience with CRVS systems. Tawheeda's family is originally from Afghanistan, and she has many family members who do not have birth certificates and who have faced multiple challenges as a result. Professionally, Tawheeda has supported Open Data Watch's gender data portfolio in partnership with Data2X, leading research projects assessing gender data gaps and intersectional gender data availability in 25 countries. Tawheeda is currently based in Toronto, Canada, and she holds a master's in global policy studies from the LBJ School of Public Affairs. Tawheeda, welcome.
Thank you, Dr. Kaufman. Hello, good morning. My name is Tawheeda Wahabzada, and I'm a data and policy specialist at Open Data Watch. Open Data Watch works in the intersection of open data and official statistics. And in recent years, we've been a close partner on areas in gender data and CRVS. As Dr. Kaufman has mentioned, CRVS is an area that I'm personally interested in, as my family is originally from Afghanistan, and many of my family members do not have birth certificates and have faced various kinds of barriers, such as access to land rights and so forth. It is a reminder that while we may be discussing data and statistics today, each of those data points are an individual with their own story to tell. Needless to say, I am very excited to moderate this panel of experts today as we speak to CRVS and gender data collection. Thank you again to everyone tuning in for today's discussion. Before we get started, I'd like to invite the audience members to participate in a quick poll. Alyssa, can you please share the poll question with the audience? As you are taking the poll, I will share the agenda for this seminar. We will be hearing from each of our panelists in turn, beginning with Irina Dincu, who will present an overview of the status of gender equity in global CRVS data collection. Next, Petra Nahmias will highlight ESCAP's work on gender inequality assessments in Asia and the Pacific. and Anushka Mangharam will share an example of planning for gender integration in CRVS systems in Bangladesh. And finally, Romesh Silva will then focus on positioning CRVS in support of gender equality and women's empowerment. After these presentations, I will hold a discussion with the panelists where they can reflect on the results of the poll you just took. Let's get started by introducing Irina Dincu. Irina is a senior program specialist at the Center of Excellence for Civil Registration and Vital Statistics Systems at UNFPA. She provides strategic direction to the Center of Excellence and oversees technical country support and partnerships, as well as technical advice to selected global financing facility countries to ensure the quality of CRVS components of their reproductive, maternal, newborn, child, and adolescent health investment cases. She has provided civil registration system audit evaluation and developed a strategy to strengthen the CRVS system in Chad and advisory services for the National Civil Registration Project in Cambodia. Welcome, Irina. You have 8 minutes.
Thank you very much for this introduction. And colleagues, it's an honor to be here today and speak a little bit about the gender and CRVS, a subject which is near and dear to my heart and which the Center of Excellence for which I've been working has initiated more than 5-6 years ago, and who has since taken center stage, and a lot of partners have taken a lot of interest in it. And I think that today's meeting is a proof that actually we are succeeding in the advocacy around gender and CRVS, putting it really proeminently on the global agenda. Having said so, I'd like to talk a little bit about why gender is critical and central to CRVS and what are some of the issues actually on the global stage and how this is brought forward by the partners. Next slide, please. If we are looking together at the Sustainable Development Goals, what they do, they seek to eliminate poverty and create better conditions for everyone. Now, for this, gender equality is a precondition. To help achieve gender equality and empower the women, it is critical to have data that is reliable, it's timely, and disaggregated by sex and age at the bare minimum. Now, this data must also capture the limitation, the inequalities of women's rights, both de jure and de facto. Only then data will serve to guide better policies, better programs, particularly for the underserved and the hard to reach, the overwhelming majority of whom are women and children. Now, existing data gaps for incomplete and failing CRVS systems, they hamper the ability of governments and the partners to achieve the ambitious 2030 agendas. This is where we stand today. Gender inequality in civil registration and vital statistics, evidence suggests that starts often at birth, it continues in marriage, in divorce, in the old age, and persists into the death, as women deaths are less likely to be registered, and when they are registered with the causes, sometimes the causes are inaccurate. Taken together, this makes it difficult for the governments to plan appropriate policies and programs across the life course. And I think that my colleague Romesh Silva is going to talk a little bit more about the life course approach. Move on, please. Next slide. This is really an overview, very small, about CRVS data, the gender-related indicators actually that would benefit, who come from CRVS and who would benefit for the monitoring of the SDGs. There are 34 of them out of 55. I think that this is really the overwhelming majority. It's not only telling us how important the gender data is, and when you are going to look at the gaps and see that actually you cannot get accurate data, you are going to see how important it is actually to achieve universal registration and bring women into the systems from birth, in particular through marriages and divorce registration, and also through death registration, which I believe for data for health, it is really critical. You are working a lot around that topic. Next slide, please. Now, where we are today, next slide. Where we sit in birth registration and actually why gender? Why did we choose, because it was the Center of Excellence who brought this on the global agenda, why we chose to bring it on the global agenda? Was it something that the center wanted to do just to be fancy or to find a niche? No, actually when we looked at a slide as this one in front of us, we have seen that it is averages. The situation seems to be great, but if you're going into the subnational data in many countries, even though there is almost no discrepancies of registration of person between boys and girls. At subnational level, I think that persistencies still are there. For example, in some Muslim countries, take Indonesia, take Jordan, take other countries where there are polygamous marriages, girls who are born out of these marriages, they tend to be less registered than the boys. And you are seeing also in sub-Saharan Africa still a big gap. So there is a need to go a little bit further into the disaggregation of data by sex and a deeper analysis. Next slide, please. If we are looking at death registration, now the death registration, the situation is really dire. Africa is almost white. We cannot have vital statistics from civil registration. Sometimes, you know, even the surveys are there. There are a lot of estimates, but the systems are not really robust enough to be able for us to actually generate vital statistics from civil registration. So what it is happening? Less than half of the deaths of the world are registered. Of the registered deaths, the cause of death information is often not captured or poorly capturing. And more troubling is the fact that the male deaths are more likely to be registered than those of the women. For example, my colleague Romesh Silva has found out that 65% of the male deaths reported in Morocco in comparison to 35% of the female deaths. Now, death registration is important not only for statistical purposes, but also for legal purposes in particular. Why? Because it closes the legal identity of the individual. And where the deaths are not registered, the dead remain legally alive, making it impossible for the spouses, for the children and the families to inherit, for the surviving spouse to legally remarry, depriving them of assets, reducing family income and increasing the poverty. And actually, it also inflates the country population on paper, compromising the effective governance and policy planning. And most importantly, if the deaths of women and girls go unregistered, it hinders the government's ability to identify preventable causes of death and develop targeted policies and programs aimed at reducing the deaths of women and girls. Next slide, please. Now you'll see that I only spoke about birth and death registration and nothing about marriage registration. Marriage registration coverage is almost impossible to actually talk about and see where we are standing today, because while the societies have long regulated the customs and the norms around marriage, the recognition of these vital events by civil law is often not sought for the reasons are sometimes attributed to ignorance of the benefits of marriage registration, economic barriers, or others. So, albeit these are effective tools for women empowerment and for facilitating access to social benefits and social protections, they do not happen. For example, a marriage certificate, it's the evidence of a woman's ability to access a pension, alimony, child support, and a fair share of assets acquired during a common marriage. Now, marriage registration has not been high on the political agenda, but it makes it more difficult for women to secure the rights between the birth and death, you know, these important events. So why gender? Please press, this is a slide which has some kind of an animation. We were wondering ourselves, if we are doing the things the same, are we going to reach the, you know, better results? Probably not. So we said that unless we are going to identify who are the missed people beyond the statistics, with research, with social research, who are they, where they are, why they are not registering, and for those who register the vital events, why they are registering, we are never going to find the right how, meaning the strategies, the right resources, and the right way to partner with communities to actually access and uptake the civil registration services. So the Center of Excellence has focused a lot on social research, on documenting best practices, producing evidence around gender and CRVS, with the objective also to putting high on the agenda. And I think that we have succeeded here because our colleagues from ESCAP, other regional commission like the Regional Commission for Africa as well, have put it out during the ministerial conference on the agenda. I think it's now with the government, you know, it's the snowball effect. We are getting there. We are not even halfway, but I think that we are getting there. Next slide, please. Now, what are the gender dimension for CRVS and why it matters for women more than for men, for example? Let's take marriage registration, and you were talking about conflicts. Allow me to give you an example from the Syria-Iraq border. For example, women trapped into the conflict who have lost husbands in conflict without marriage registration and without possibilities to actually register their children. So intergenerational cost of non-registration of marriages. The women who are uniquely poised to be agents of change. Why? Because when you are investing in women, when you are partnering with communities, in particular women, what is happening is that women are most likely to actually focus on their household to improve the well-being of the household, including registration. And another important gender dimension, for example, in countries who have shown almost universal coverage like Thailand, the access to financial services is much higher than in countries who do not have universal birth coverage. Next slide.
Irina, I'm sorry to interrupt. For the sake of the translation, could you please slow down a little bit? Thank you.
Yes, I'll try. Next slide, please. Another why CRVS is also important, in particular for women, because it could be a tool not only protecting against child marriage, but also finding out the perpetrator. Women who do not have a birth registration, who do not have the birth certificate, are less likely also to have ID cards, to participate into the political arena, to be elected, to elect, access to education as well, in particularly secondary education. So having this first document can improve into the long term their political voice. And complete CRVS data can be used also to track and to make visible the women and the girls left behind. Next slide, please. What we have seen with the two slides around birth and death registration, who were nicely published by our colleagues from UNSD, we have seen that averages, they mark inequalities. They mark inequalities not only in birth registration, but also in death registration, in marriage registration. That there are intergenerational costs of non-registration of such events, and that non-registration on death actually can perpetrate not only such inequalities, but can also lead to financial costs, to health costs, because the focus would be on other programming. And that financial incentive evidence suggests, and I am going to send you to the gender briefs published by the Center of Excellence, that the financial incentive helps close the gender gap in CRVS and ID coverage. There is the cost, however, of putting these systems on the rail to make them sustainable, data with everybody having the document as well as data generated from the system is very big. Next slide, please. The global CRVS plan developed by the World Bank and the partners back in 2014 and supported by the government of Canada put the cost at around $3 billion, with $1.5 billion from the national domestic funding, and the rest coming out from the international partners. Now, we also estimate that this cost is heavily under research, that it was not really done with proper economic tools, with proper CRVS assessments. So we might be higher than the 3 billion estimated if we take into account that 300 million were estimated for Ethiopia and 200 million for Tanzania alone. Next slide, please. What I would like to say here, I mean, how do we close the gender gap? Of course, political commitment is critical, and I salute our colleagues from the regional commissions, the colleagues from the governments at the country level who have actually put gender on the agenda, who have put gender as a priority into national strategic plan. But this is really not enough. I think that we will have to go beyond this, allocate and disburse from the national budget clearly lines for women, in particular registration of vital events pertaining to women. Partnering with communities, this is key. How do we collaborate with the tribal leaders, with the village chiefs, with the imams and the priests, with the mayors in order to increase such things? How do we bring knowledge and research? We all think that we know everything about marriage registration, birth registration and death registration. But when we did a little literature review together with our colleagues from Vital Strategies around what we know around the social determinants of non-registration of vital events, we actually find out mostly anecdotal evidence or many things pertaining to ethnography, but very limited things around civil registration, social determinants of non-registration or of registration of vital events. And another thing is that how do we find the balance actually between operations, between legal, between partnering with communities, what we have to invest? Do we have to invest only in digitization, or should we move this a little bit around and you know, find the balance of power which is necessary for everyone? We do not have the answer to this. I believe that we have the ingredients together with our colleagues from UNFPA, where the center sits since this summer and who are so generously hosting us. We have started the largest and I think the only one initiative around connecting vital events registration and gender equality in 14 low and middle income countries. Converge, it's his title. I think that my colleague Romesh Silva is going to talk more about it, to see about its successes and actually what could be done to improve the situation of women and girls in the world and have everybody registered and counted by Horizon 2030. Thank you so much.
Thank you, Irina. Thank you, Irina, for laying the foundation for this seminar by showcasing gender gaps in CRVS coverage, especially the gaps in death registration and even marriage registration when it comes to customary marriages. And now I'd like to introduce our next speaker, Petra Nahmias. Petra heads the Population and Social Statistics team at the UN Economic and Social Commission for Asia and the Pacific Statistics team, leading work on a range of topics, including CRVS, gender statistics, migration statistics, and data integration in this Asia and Pacific region. She has worked in both international and national statistical systems for nearly 20 years, including UNHCR, the UN Population Division, the UK Foreign, Commonwealth and Development Office, and the Israel Central Bureau of Statistics. She holds a PhD in sociology and demography from Princeton University and an MA in demography from the Hebrew University of Jerusalem. Welcome, Petra. You have 8 minutes.
Thank you, Tawheeda, and thank you very much for this opportunity to present on some very exciting and, as Irina said, quite new work for us in ESCAP. I'm going to be talking about inequality assessments of CRVS systems in Asia and the Pacific, looking at the different challenges and opportunities which have recently arisen. Next slide, please. So my presentation, I'm going to first just give a bit of context around the Asia-Pacific CRVS decade and how inequality assessments sit within them. And then a quick look about why inequality assessments are important and the relevance for gender. And finally, a look at some of the work underway at the moment in ESCAP. Next slide, please. So in 2014, in recognition of the role that CRVS plays in supporting development, governments and civil society partners came together at the first ministerial conference on CRVS in Asia and the Pacific to really concentrate efforts on improving CRVS systems. And as part of that, they articulated this shared vision that by 2024, all people in Asia and the Pacific benefit from universal responsive CRVS systems that facilitate the realization of their rights and support good governance, health, and development. And this is really what's been guiding our work in the decade. And to achieve this vision, governments committed to improving their national CRVS systems by first adopting the ministerial declaration to get everyone in the picture in Asia and the Pacific, and that's kind of our slogan that's marked the decade. Proclaiming the Asian Pacific CRVS decade, 2015 to 2024, as a timeframe to accelerate efforts and achieve this vision, and endorsing the regional action framework to support the improvement of CRVS systems. Next slide, please. So the ambition was set through this regional action framework, and the goals and targets of the framework offer measurable outcomes that reflect progress towards the achievement of the shared vision over the course of the decade. And these three goals relate first to universal registration of vital events, second to the provision of legal documentation of these events in order to facilitate documentation of legal identity, and finally the production of vital statistics from civil registration records, including on causes of death. Next slide, please. So associated with these 3 goals are 15 targets, and the countries set their own national target values for each target based on their own ambition and capacity. The setting and achieving these goals and targets requires a step-by-step and systemic approach, and there are certain things which need to be in place in order to achieve a universal and responsive CRVS system. And that's these 8 implementation steps that you see, and they serve as a template and guide for this process. So a well-functioning national CRVS system is critical not only for implementing the regional action framework, but the implementation steps are also essential for ensuring that these improvements are sustainable and have a broad, long-lasting and positive impact. And in that regard, in the context of what we're looking at today, an inequality assessment is absolutely essential. And it's really needed in order to identify the marginalized and hard to reach groups and understand the barriers that they face. I think as Irina was saying, showing in her slides, we don't, there's lots of countries where we don't even know who's being left out. So we have this big unknown that we really need to understand in order to be able to have some policies to ensure their inclusion in CRVS systems. Next slide, please. The next slide's actually got an animation, so I'll ask you to click in a minute. There's 2 animations. So here you see the implementation steps, how countries reported on them in our midterm review. We're now at the midpoint of the decade, and we did a review of progress against the regional action framework, including reporting on these implementation steps. And if you can click, please. You see here the inequality assessments, and you can see very clearly that of all the implementation steps, if you could click again. Yeah, so you can see that it's the weakest and that only 6 countries have actually completed an inequality assessment. And out of those, we didn't have any templates or guidance as to what this actually looked like. So the quality of this varied between countries, and no countries actually did a robust and rigorous and quantitative assessment of inequalities in CRVS systems. So clearly we could see that there is a gap here. Next slide, please. So as we saw, a few countries have actually conducted these inequality assessments. And we know that this is really difficult because you're not just measuring the completeness, but also the coverage and who's left out. And these are often populations which are actually very hard to reach. But we really need to do this in order to understand these inequalities. Otherwise, we're not going to reach our targets. And what we've also seen is that this isn't just an issue of the low capacity countries. Actually, as CRVS systems improve, as more people are covered, there's more of an effect on the individual of being excluded. So if you're in a country where most people's births aren't registered and your birth isn't registered, then the effect on you as an individual is less than if you're in a country where the expectation is that births are registered, where you're asked for documentation at every stage and you've been excluded. The effect on those excluded groups can be even greater. So we do need to understand in all contexts who's being left out. I'm sorry, Tawheeda, I will speed up. Next slide, please. So why is this important? I'll go quickly through this. First of all, as we said before, it's because CRVS is needed for legal identity. The documents allow people to prove who they are, and this also unlocks access to other services such as health and education and so on, and social protection. Next slide, please. The next reason is to be included in the statistics. The civil registration is used to produce vital statistics and for population measures. There's various SDG indicators which are directly measurable through CRVS systems, but also if we want to disaggregate population-based development indicators, we need to be able to measure these population groups. And if they're left out of the statistics system, then their invisibility and marginalization increases. Next slide, please. So who might be left out? Well, obviously, gender is a key characteristics, but there are many others. And since I have not much time, I won't go through them, but you can see the list here of the factors which might influence access to civil registration and the populations who might be left out. Next slide, please. And what's key as well is that these don't occur in isolation. They're often overlapping and they intersect. And this can be compounded to intensify exclusion. They're not mutually exclusive groups. And this can really magnify the risk for women and girls of being excluded from CRVS systems. Next slide, please. And COVID-19 has really emphasized this problem, especially with the spotlight on mortality statistics in this case. We know that the impact of COVID-19 is not equal in different population groups, that sex and income and ethnicity, they can all affect how the pandemic impacts. And these are the groups which exactly overlap with inequality in death registration. So if we want to understand truly the impact of the pandemic, then we need to make sure that everyone's being included, and we need to know who is being left out and to be able to quantify that. And I will go very quickly to the next slide, please. So what are we doing at ESCAP? We've seen that there's a gap. We know that this is really important. Last year, we got a group of experts together in order to look at how we can provide more guidance for countries on doing these inequality assessments. We looked at the qualitative assessments, and there's also a toolkit that's available called the Bali Process Toolkit, which looks at certain population groups such as refugees, asylum seekers, stateless people, and how we could use that to do more general assessments. But we also looked at how we can do quantitative assessments using secondary data sources and applying indirect demographic methods. And I know this is going to be made available, so the links are all there if you want to look at any of this in more detail. Next slide, please. And our current project, we're taking this guidance from last year, and we're trying to implement it in a number of countries. So we're working with 5 countries, Fiji, Laos, PTR, Pakistan, Samoa, and Bangladesh, and we're supporting them in conducting these inequality assessments using secondary data sources. And we're also working at the regional level to try to share these experiences and increase country capacity to be able to carry out these kinds of assessments. And we're very much hoping that by the end of the decade, when we do our final review, that we will be in a much better position than we were at the midterm. So with that, I will apologize for going over time, and thank you all for your time, and hand back to Tawheeda.
Thank you so much, Petra. You shared such important and detailed information about how to conduct inequality assessments. We will be addressing questions to the audience. The audience might have for Irina, Petra, and all other speakers during the Q&A at the end of the panel discussion. Please feel free to submit questions as we go along. For our next speaker, I would like to introduce Anushka Mangharam. Anushka is the Technical Advisor for CRVS Improvement Program at Vital Strategies, where she leads CRVS improvement efforts in Bangladesh and in Cambodia. This involves establishing key relationships with governments and other stakeholders, overseeing advocacy and governance efforts to improve CRVS and cause of death data collection, and analyzing and using such data to improve public health. As a member of the Bloomberg Philanthropies Gender Equity Working Group, Anushka has been an advocate for efforts to reduce sex disparities in birth and death registration completeness, and the inclusion of the Ministry of Women and Children's Affairs and CRVS strengthening activities in countries. Anushka has worked in public health with governments in the Asia and Pacific region for over 10 years and holds a Master of Public Health degree from the Harvard T.H. Chan School of Public Health. Welcome, Anushka. You have about 4 minutes.
Thank you, Tawheeda. So today I'd like to share a country experience for gender-inclusive CRVS data collection from Bangladesh. Next slide, please. But before I jump into that, perhaps it's useful to provide a recent timeline of CRVS strengthening activities in Bangladesh since the Data for Health initiative started working closely with the government in 2016. In the early years, between 2016 and 17, there was a strong focus on setting up a coordination mechanism between the newly established Office of the Registrar General with the health sector and the statistics division under the leadership of the Cabinet Division. From 2017 to 19, there was a period of piloting a model to strengthen birth and death registration by linking the health sector with the civil registration sector, a model popularly known as the Kaliganj model, and also simultaneously setting up cause of death data collection systems for deaths that happen both within healthcare facilities as well as outside healthcare facilities. During this period, there was also some routine data analysis conducted, including sex disaggregated analysis. But more recently, since 2020, there have been efforts to scale up birth and death registration, and with this to look at any disparities in completeness rates, especially along the lines of sex. This applies to cause of death data as well. So what have we been seeing? Next slide, please. So across the board, and this is not a problem that is unique to the case of Bangladesh, but we see fewer female births and deaths that are registered compared to male births and deaths. This is especially so for death registration because people tend to see value in registering deaths mainly for things like inheritance that are generally not passed down through the mother, but more through the father. In some of the lowest performing sub-districts in Bangladesh, we see only one female death registered for every 9 male deaths registered. Similarly, we do also see some skewed sex ratio in MCCD data, where fewer female deaths in hospitals are certified. This is a more complicated issue because it could be really due to skewed admission profiles in hospitals, skewed mortality profiles of maybe fewer women dying within hospitals, or just a systematic under-certification of female deaths. The issue is quite complicated and needs more investigation. Next slide, please. So since 2021, when phase 4 of the Data for Health initiative began, there has been a focus on closing the gap in CRVS data collection. Some of the key efforts being driven to achieve this are advocacy and awareness building efforts, which include plans to involve the Ministry of Women and Children's Affairs in the CRVS implementation work. CRVS implementation work so far has traditionally mainly involved the Office of the Registrar General and the health sector with the statistics division, but involving the Ministry of Women and Children's Affairs lends more importance to closing the sex disparities in CRVS data collection and use. Another very tangible way of trying to close the gender gap in birth and death registration has been the use of ward meetings at the sub-district level to underscore the importance of registering births and deaths of girls and women. Another big effort to improve birth and death registration of girls and women has been monitoring and evaluation. I mentioned earlier that sex disaggregated CRVS data analysis does happen, but we need to look more critically at the data and address areas where we don't see equity in birth and death registration. Some of the poorer performing sub-districts have already begun face-to-face trainings with government to balance out this disparity. And finally, I think one of the speakers before me, Petra, mentioned that the inequality assessment, which ESCAP has been leading, really plans to look both quantitatively and qualitatively into some of the sex disparities and their underlying causes, and to make sure that they can be addressed. Next slide, please. So with that, I wrap up the country example of gender inclusive CRVS data collection in Bangladesh. Thanks very much.
Clearly, we have a lot to learn from the Vital Strategies teams that they had in Bangladesh. And now I'd like to introduce our next speaker, Romesh Silva. Romesh is a demographer, and he is the technical lead at the UN Population Fund for Improving CRVS Systems. He also leads the fund's work on population data estimation and humanitarian settings. His research focuses on the development and application of demographic methods in low and middle income countries and spans direct and indirect demographic methods, and in recent years has also included qualitative methods. He chairs the IUSSP Scientific Panel on Population Perspectives and Demographic Methods to Strengthen CRVS Systems. He serves on the National Academies of Sciences Expert Panel on the Demography of Forced Migration. Romesh earned his PhD in demography from the University of California at Berkeley, and he is based in New York City. Welcome, Romesh. You have 8 minutes.
Well, thanks so much, Tawheeda, and really a warm thank you for inviting me to be part of this exciting seminar series. It's really a pleasure to be part of this distinguished panel and to be hosted by one of my old stomping grounds, the Johns Hopkins Department of International Health. My colleague, Irina Dincu, has already laid out very nicely some of the key connections between CRVS, gender equality, and women's empowerment. So allow me to spend a little bit of time today emphasizing why a life course approach is so important. Secondly, to walk through 2 country case studies, one from Ecuador and one from recent work in Ukraine. And then lastly, to close out with some key messages on CRVS and gender from our 2020 Global Converge conference, organized by the Center of Excellence, UNFPA, and Open Data Watch. Next slide, please. This visual depicts 4 of the core vital events across the life course, and it shows why civil registration and vital statistics are critical for gender equality and women's empowerment. The blue boxes highlight important areas of thematic engagement, while the orange boxes note focus areas that are critical in advancing gender transformative population data systems. In the interest of time, let me just focus on death. Thematically at UNFPA, death registration is critical for our work, as 2 core objectives of the agency are, firstly, getting to 0 preventable maternal deaths by 2030, and then secondly, reducing sex-specific health disparities. In terms of our support to integrated population data systems worldwide, our work supports the production of mortality statistics that are sex and age disaggregated and highlight gender-specific health disparities. Is the lead United Nations agency supporting the decennial census round on population and housing censuses. Up-to-date death registration data are critical for our support to UN member states in producing post-censal and intercensal subnational population projections. And I'll talk about that a little bit more in a humanitarian context, but also in a more sort of long-term planning situation. These kinds of projections are really, really important for planning, the long-term range of health clinics, schools, retirement homes over the next 20 to 30 years. And at UNFPA, we have a strong emphasis on the importance of marriage and divorce registration, as these are oft neglected components of the CRVS system, yet critical for women's empowerment and gender equality. Next slide, please. This visualization shows work that we undertook in the last few years with the Ecuador National Institute of Statistics and Census through the Converge initiative. The x-axis depicts the completeness of death registration as a percentage, and along the y-axis, you have the main subnational administrative areas of Ecuador. The vertical dotted lines show the national average for death registration completeness in Ecuador. 65% for women, depicted by the orange vertical dotted line, and 68% for men, so a 3 percentage point difference. But these national averages really conceal notable variation across the different regions of the country and between males and females. Death registration in Ecuador, death registration completeness in Ecuador varies from above 80% in some regions like Chimborazo and Azuay, but is below 40% in areas like the Galapagos and Sucumbíos in the bottom left corner of the visualization. But further, in almost all regions of the country, male death registration completeness is systemically higher than female death registration completeness. And in some regions, such as Maruna, Santiago, the sex differential is around 17 percentage points. Such sex-specific disparities in death registration completeness have massive implications for gender equity and population health. If we are systematically missing the magnitude and the nature of female deaths, then our ability to understand and respond to women's health needs and female mortality trends are sharply hindered. Next slide, please. Civil registration, unlike censuses and household surveys, are a continuous population data system. This has proven critical for UNFPA's response and the entire UN humanitarian system response to the unfolding humanitarian crisis in Ukraine. The last population census in Ukraine was in 2001. However, the civil registration system has been well maintained the past few decades, and routine vital statistics have been produced by the National Statistics Office of Ukraine. This has allowed us to produce updated baseline subnational population projections by updating the old census data annually with annual birth and death registration data, as well as administrative statistics on recent migration flows. In partnership with our sister UN agencies, UNHCR and IOM, we're using these projections alongside internal displacement data and refugee flow data. The far right-hand side of this visual shows an online humanitarian planning tool that we have developed at UNFPA to support our humanitarian teams on the ground in Ukraine, but we also do this in many, many other humanitarian settings around the world. This tool synthesizes the best available population data to help estimate key indicators like the number of pregnant women in different areas of the country and the estimated number of newborns who will likely experience complications in the next 3 months. Without up-to-date vital registration in Ukraine, humanitarian needs assessment and response planning would be even more challenging. Again, something as seemingly simple as routine annual up-to-date vital statistics is supporting life-saving humanitarian action today. Next slide, please. The Center of Excellence has hosted 2 global conferences on CRVS and gender in 2018 and more recently in 2020 as part of our work in building a global coalition to support the movement around CRVS and gender. This slide shows the key messages from the 2020 Global Converge Conference. Many of these key messages Irina and Petra and Anushka have already touched upon, but let me emphasize 2 that certainly need much, much deeper and stronger engagement. First, support for country ownership of CRVS systems and a human rights-based approach. Ultimately, CRVS systems need to be country-owned and country-led and are the basis for legal personhood. Second, CRVS improvement efforts need to factor in the political, cultural, and legal environment context. There's no one-size-fits-all here, and context truly matters. Next slide. So today, in the interest of time, let me just emphasize one last point, which perhaps bears repeating. the importance of a life course approach to CRVS and gender is absolutely fundamental, from birth to death, but including marriage and divorce registration. In fact, in many countries, both in terms of the law and in terms of social and cultural norms, impediments to marriage and divorce registration actually lead to impediments for birth and death registration in the same kin networks. And so we do need a systems approach here and not a pick and choose approach of focusing on just some vital events. Thanks again to the teams at Hopkins for hosting me, and I'm really looking forward to the discussion and Q&A.
Thank you, Romesh, and thank you especially for sharing the unfolding humanitarian context in Ukraine and the state of their CRVS system. And now let's take a look at the poll results. Alyssa, can you please share your screen with the poll results? So the poll question is, which type of CRVS data set has the most complete gender and sex information in the country where you live and work? 81% of poll respondents mentioned birth records, which is then followed by death records, then marriage and divorce records. I'd first like to ask Irina for this poll question. What are your thoughts? And also, I'd also like to further weave this into one of our audience questions. Could you further comment on the regional variations in the gender gap in CRVS data? And is there a clear pattern with some regions having greater gaps? And does the pattern vary by birth, marriage, and death registrations? Thank you, Irina.
Yes, thank you very much for the question. Well, if I do not want to really go back to the slides, so let's say on birth registration, evidence suggests that with few exceptions, there is no discrepancies between girls and boys, females and males. We are mostly taking this information for the low and middle countries from the DHS and the mix, with the caveats that some are looking only at some specific age. When it comes to death registration, I think the situation is slightly different, because unlike the mix where our friends and colleagues from UNICEF are asking in the survey about the possession of the death certificate, we don't really know about the death certificate. We do not know around death registration also because we have not really looked into the data who are the unregistered. We see a lot of discrepancies, right? We see a lot of discrepancies in the really very little data which we are having and on which analysis has been done. If I'm looking, for example, at a country like Jordan, I mean, most discrepancies, I believe, probably will be sitting in sub-Saharan Africa. I'm going to give a couple of examples from there, but I think that they are all over the world. For example, in Jordan, if I take the registration of deaths, we are sitting at a very, very good average, above 80%, right? When we are looking at the registration of male deaths, you're going to see, taking into account the region, somewhere between 82% going to 86%, 90 plus. When you look at the women, the registration of female deaths is 60%, 92% and so on. This if you're only looking at female and males. Now, if you're going into more disaggregated data by age group, you're going to see that neonatal deaths are not registered at all. Children deaths are not registered at all, in Jordan. Why? We don't really know why. We don't know whether it is by incentive, it is because there is no incentive, or, the families, it's a tragedy for the family and so on. I think that we'll need to look further into it. When I look at the discrepancies, I take a country like Guinea-Conakry, and I always give these examples. They cannot produce vital statistic reports. This is the case for most of the countries in sub-Saharan Africa. So we cannot really know the discrepancies unless we are looking at the surveys. Guinea-Conakry has produced reports on vital statistics from CV registration. Registration of death stands at 1.86%. Is this relevant? No. But when you're looking at the discrepancies, so disaggregated by sex, you're going to see 86% of the registered deaths are males. Why? We don't know why. If we're looking a bit into the, we can try to figure it out because the males are civil servants, they are teachers, they are traders, maybe there is an economic incentive, but we don't really know that. So we have to dig deeper into that. There are discrepancies as well in Latin America, from Peru to Colombia to all the countries. I'd say that I cannot really give a statistics where the discrepancy is bigger, just because some of the continents really don't produce this data. I think that we have to go deeper into details, not only wait for the countries to reach 80% death registration and then encourage them to work on vital statistics report. Do like Guinea, produce vital statistics report even if you are at 1%, so that you learn how you do it, right? And I would say that it is important. Yes, I know we are working on death and birth registration. Most of the organizations are covering that, but I would encourage you to look also at marriage registration coverage, because lots of discrepancies are sitting there. If you're looking again at Muslim countries, polygamous marriages who are registered and so on, I think you're going to find again some other things. So in conclusion, I cannot really give an overview. I'll let maybe Romesh or other colleagues who are much more better demographers than I am, because I'm not one, go maybe into the details. But I think that one, we are not having a clear pictures because it's mostly from surveys. Two, when there is a picture, it is by averages and it's not sex disaggregated. And three, we will really need to dig deeper and see whether we are going through the census or we are going through other means to really correct these discrepancies happening into the field. Over.
Thank you, Irina, and thank you for especially emphasizing the discrepancies in collecting death data. And Petra, I wanted to ask you about your thoughts with regards to the poll results.
Yeah, I don't think it was much of a surprise. We know that birth registration that's really been, I think, a lot of the focus of the work. It's the vital event that's best recorded. There's lots of incentives to record birth. And it's the one that we know the most about as well. It's asked about in surveys very often. It's easier to get a handle on the number of births to different population groups. So yeah, it wasn't a surprise. I mean, the next one is death registration, and we saw that so much weaker than births, and we know far less about it. And that's a big hole in terms of when we've done research in our area, we've looked at the gender gap in death registration. We don't find much of a gap, but that doesn't mean that there isn't one, because the countries that we know about are the countries with the best systems. The countries which are reporting death registration disaggregated by sex, and they're the countries which are least likely also to have a gender gap. So we can't assume that because we don't see it that it's not there. And then, like Ramesh has done work in various countries where the evidence is pointing to there being a gap, even if we're not seeing it in the reported data. So we think there is one, but we're not seeing it. And then, of course, with marriage and divorce, that's just that. I'm ashamed to say that in our regional action framework, for example, we don't talk about marriages. We don't have a target even on marriage, because it's so challenging that we said, let's get our house in order with births and deaths. And then we can look at later on at marriage and divorce, but it's one which we're pushing to the back all the time, even though it has such implications for women and women's rights and women's protection. So it wasn't a surprise, and I'm glad that everyone also kind of, I think that their awareness reflects that reality.
Thank you, Petra. And Anushka, are you surprised by any of the results? Are they consistent with your work in Bangladesh?
Yes, definitely. I think I mentioned in my presentation as well, it's the disparities in when we look at the sex disaggregated data, definitely show up more when we look at death registration data, and to some extent even cause of death data. It's less so for birth registration data. So yeah, it's very consistent with what we're seeing in Bangladesh, and the emphasis really on for our interventions as well is to try and pull up some of that data that we're seeing with regards to deaths in the country.
Thank you, Anushka. And Romesh, can you comment on the poll results with regards to Ecuador and Ukraine?
Yeah, sure. Thanks for the question. Certainly, you know, I think Irina said it very nicely. You know, one of the issues here is to really understand some of the behavioral and social norm incentives and barriers to registering different types of vital events in different places. You know, and so the context in Ukraine, in terms of, you know, the way administrative data systems and official record keeping works, you know, is fantastically different given the sort of heavy influence of the former Soviet Union with compared to Ecuador. But the other thing which I want to kind of emphasize a little bit more is this real need for a systems approach. And when at UNFPA, when we talk about a systems approach, you know, in our CRVS work, we actually mean two complementary things. We talk about a systems approach to the CRVS system. So birth, marriage, divorce, and death, because they're interdependent. The registration of all of these events are interdependent. But secondly, a systems approach in terms of not just looking at the civil registration system as a standalone, but understanding the civil registration system and engaging it as part of a broader integrated population data system, which involves the health information system, household surveys, the population and housing census, and increasingly more and more national identity systems. And I think Petra said it very nicely that, you know, we really do need to, our ability to do some of this work in places as diverse as Ukraine and Ecuador, you know, speak to the importance of developing an integrated population data system. And so I wanted to really emphasize this point because, you know, I think that's, in our opinion, you know, that systems approach, and also coupled with the behavioral, you know, norms, social dimensions approach, is what differentiates our ability to really delve deep and understand inequality, where, as opposed to places where we're scratching around a little bit in the dark. Thank you.
Thank you, Romesh, and thank you for highlighting the systems-based approach of CRVS systems and how it's tied to household surveys, health MIS systems, along with ID systems. And now for our second question, many countries have a functioning CRVS system in place, and yet are struggling with where to start in terms of integrating gender equity. What aspect of gender integration into CRVS systems do you think is most important to prioritize? We will first start out with Anushka for this question.
Thanks, Tawheeda. Yeah, I think it's a really interesting question because it's definitely very challenging to address the gender equity component in CRVS data collection. And, you know, the reality is that most of the agencies that are usually involved in civil registration strengthening, their core mandate is not necessarily to focus on sex disaggregated data. It's to look at overall strengthening of birth and death registration, cause of death data collection. So, you know, one of the ways in which I mentioned in my presentation as well, that we're trying out in Bangladesh is really to involve the Ministry of Women and Children's Affairs. Another way, of course, is the legal and regulatory review that we, you know, try to conduct when we work with countries, so that CRVS data collection is more inclusive and removes barriers that are faced by specific groups of people, whether it's women, whether it's minorities, etc. I think, those are some of the ways, the tangible ways in which this problem can be addressed. And I think also, in terms of what to prioritize, it's hard to say, just because, both birth and death registration have their merits and cause of death data collection as well. I wouldn't say one over the other necessarily, but yeah, I think, getting the relevant parties invested and also trying to see what the regulatory barriers are some ways in which, to address the issue.
Thank you, Anushka, and thank you for also mentioning how other ministries can be involved in the case of Bangladesh and its Ministry of Women, and to understand other legal barriers as well. And and with regards to the second question, Petra, I wanted to ask you on your thoughts on the priorities for integrating gender into CRVS systems.
Yeah, so I mean, thinking with, again, the inequality assessments hat on, for me, we've also got to get the basics right. We've got to have death registration reported by sex. We've got to have birth registration report, which it is. I mean, birth registration, it's okay, but death registration, so many countries, we just don't know the extent to which women's deaths are not being reported. We don't know the extent to which their cause of death is not being recorded. And I think that we have an opportunity now with the pandemic to really shine a spotlight on this, and to I think the case has been made, unfortunately, for why functioning CRVS systems are important. We know that there's going to be shocks and pandemics in the future. So now is, I think we should really be striking while the iron is hot to ensure that mortality and in this case, but CRVS systems in general are improved, which means also making them gender inclusive and getting those basics. So seeing the vital events reported by sex, that for me is like, we're not doing the minimum, we're not doing the absolute basics. So I think that sometimes, talking about some of the higher level stuff, which is fine, but let's get the basics right. Let's get those countries who aren't able to even report death by sex, let's get that sorted, and then we can move on to bigger and better things.
Thank you, Petra, and thank you for especially emphasizing focusing on the basics first. And now we will ask the speaker selected questions from the audience. The first question is for Ramesh, and one of the audience asked, in my country, the percentage of death registration is very low. What suggestions can you give us to increase the registration of deaths?
Yeah, thanks so much for the question. At the risk of sounding like a broken record, I think that the social and behavioral aspects of why many deaths go unregistered is critical. It's a critical starting point. And secondly, to recognize that, any form of vital event registration, whether you're talking about birth registration or even death registration, it's a passive process, and it actually is a multi-step process. It involves notification, registration, and then certification. And so I think, Petra touched on it very briefly, but, one very humbling piece here is to recognize that there's quite a bit of attrition in different places in terms of the number of births which are notified versus registered versus actually certified, right? And so some of the completeness estimates on birth and death registration are actually probably telling us you know, some of them refer to completeness of notification, some to registration, some to actual certification. And I think what we do need to do is highlight the importance of, you know, engaging communities and understanding how these very complicated bureaucratic processes around registration, notification, registration, and certification, and the integration of digital technologies can be integrated into life processes in different communities and different cultures in a respectful and meaningful way. Because I think, you know, if we don't do that, then, you know, there'll be this persistent gap, you know, in terms of access to the civil registration, and then visibility in, you know, vital statistics and population data.
Perfect. Thank you, Ramesh. For our second audience question, this one is for Petra. Many countries are starting to do a gender strategy to improve gender equality and empowerment with political support. How could UNFPA, ESCAP, the Center of Excellence, and other stakeholders come together to influence these plans to better integrate gender into countries with foundational data systems such as CRVS? Petra, the floor is yours.
Yeah, thank you. That's a great question. And I think that it also really speaks to the fact that CRVS is a multi-stakeholder system as well. And I think that to a certain extent in the UN has almost, I guess, a convening power. And it can sometimes, where it's not always happening of its own accord, bring together the different stakeholders. So whoever's involved in the gender strategy, Ministry of Women or Communities, or whichever ministry is leading that, but to bring them together with Ministry of Interior, Ministry of Health, Ministry of Finance always, and all the various other ministries who are involved in CRVS systems, to ensure that there is this exchange of information. For example, with the inequality assessments work, we've started this off with an inception workshop, which brought together all the stakeholders, including the policymakers, the ministries which might use the data and the results of the assessment to ensure that it's going to be used. And that's being, I think, quite a useful step in making sure that this is going to be integrated with other strategies. So I think that we do have an advocacy role, and to a certain extent we also have a convening role as the UN, which is perhaps an advantage compared to other organizations who might have more direct technical expertise and skills in the different parts of the system.
Thank you, Petra. And Irina, I wanted to ask you the same question on how UNFPA, ESCAP, Center of Excellence, and other stakeholders can come together to influence these plans to better integrate gender into countries' foundational systems like CRVS. Irina?
Yes, thank you very much, Tawheeda and colleagues. I think, you know, that answer is not really simple, but if we're looking at the global stage, actually, we are seeing only one initiative who stands up about you know, connecting vital events registration and gender equality and improving, you know, gender coverage of vital events, in particular pertaining to women in countries. This is an initiative which spans 3 continents, 14 countries. We are aiming to grow it now. It's the Converge initiative, which the Center of Excellence started in partnership with UNFPA a couple of years ago, and we have finalized the first phase. I would say that this is one of the ways of, contributing to the global effort, which is currently being done. I believe that 14 countries, a lot of countries. From 0 to 14, it's a significant improvement, and I think the statisticians and demographers among us can tell us about this. And I think that it is also important beyond that to have closer collaboration, more openness between the organization, have an alignment of different agendas as we are moving forward. And why not having under different models of nutrition, for example, or polio eradication, or other models from global health, global ambassadors around civil registration and vital statistic causes, famous persons who have been really affected by that, and also people from the communities. But I would invite you to call countries and other organizations to join our efforts on the Converge initiative. Over.
Thank you, Irina. And for our third audience question, this one is directed to Anushka first. As Bangladesh seems to have seen some great improvements over the years, are they currently recording any CRVS data on non-binary people?
Yeah, that was a great question. To some extent, yes, especially in the cause of death data, we do see medical certification of cause of death data that does capture gender beyond just male and female, which is great. It is something that definitely needs to grow in terms of like in the overall CRVS system and the recognition of non-binary individuals. But it's a process, and as I mentioned, throughout the evolution of the CRVS improvement work in Bangladesh, it's taken a long time to reach a stage where we're able to look at sex disaggregated data just for females, and so this is something we're working on, but it's probably going to take a while to grow a little bit more.
Thank you, Anushka. I'm excited to see how the project unfolds over time. And Ramesh, I wanted to extend the question to you. Are there, with regards to any countries that may be collecting data on non-binary people? Ramesh, the floor is yours.
Yeah, thanks a lot. I think the most progress that we've seen in recent years on this has really been in Latin America and the Caribbean. I think in particular, the UN Special Rapporteur and sexual and other gender identities has really highlighted this issue quite effectively, and partnered very strongly with both community and civil society groups and UN member states in trying to integrate non-binary recognition, both within the 2020 round of census, but also the continuous civil registration, vital statistics, and legal identity systems in these countries. And so I think, if we're trying to look for some lessons learned and some insights into some really, really important early gains, I would guide people towards some of that work in Latin America, and particularly the writings of the UN Special Rapporteur there.
Thank you, Romesh. And thank you, Anushka, Romesh, Petra, and Irina for attending this panel discussion. And thank you, audience, for attending this event. And now I will turn the mic back to Dr. Kaufman for closing remarks. Over to you, Dr. Kaufman.
Thank you, Tawheeda. And Thank you again to all of our panelists and to the audience for such great questions that have come in. Any that we did not answer, we will be addressing in a frequently asked questions document along with the recording. We hope that today's seminar has started your thinking about integrating gender equity into your CRVS work in new and insightful ways. We are asking Data for Health partners to spend the next few minutes taking a brief knowledge check on the materials presented today. This will qualify you for a gender equity certificate at the end of the seminar series. The knowledge check is offered in French, Portuguese, Spanish, and English. You can scan the QR code in the slides or use the link in the chat. The Zoom webinar will stay open for the next 10 minutes in case you have any problems accessing the knowledge check. But we hope to see you in 2 weeks on Wednesday, the 23rd of March at 9 a.m. Eastern Time for the next seminar in the series, Gender Considerations in Mobile Health Data Collection. Thank you.